Um, Chair Carter, we're ready to start. If you are ready, County
I
Manager
agree,
Ryan
Jim.
O'Connor will join us in 1 minute.
Thank you
But we can start
very
first
much.
if you're ready.
Okay, yes, we are ready to start. The Ramsey County Board of Commissioners meeting is now called to order. Will the clerk please call the roll?
Freda,
Here.
Maris Castillo,
Here.
McDonough,
Here.
McGuire,
Here.
Ortega,
Aye.
Reinhardt. I don't hear Reinhardt.
I don't see her. I'm sorry.
No.
And I currently don't see Reinhardt in the attendee list as well. So I'll
right.
continue to monitor that. And Carter.
Here, thank you very, very much. I am going to call then on Commissioner McDonough to say the pledge for us while we all mute. Thank you.
Thanks, Madam Chair. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Commissioner McDonough, for that Pledge of Allegiance. The agenda of our November 9th meeting is before you, board members. Is there a motion?
So move, Madam Chair. McGuire. Second.
Thank you, Commissioners McGuire and Ortega. Are there any questions or comments on our agenda? If not, will the clerk please call the roll?
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Freda,
Aye.
Maris Castillo,
Aye.
and Carter.
Aye, thank you very much. The agenda is passed and the minutes of November 2nd are before you for approval. Is there a motion?
Move approval.
Second.
Thank you, Commissioners McDonough and Maris Castillo. Any questions on our minutes from November 2nd? Will the clerk please call the roll?
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Freda,
Aye.
Maris Castillo,
Aye.
and Carter.
Aye. And thank you very much. The minutes have passed. We will start our day off with a couple of ordinance procedures. There is item number 3. Is there a motion on item number 3, amendments to the Ramsey County Administrative Ordinance to waive the second reading?
So moved.
Second.
Thank you very much, Commissioners Ortega, and I believe that was McGuire. We have the motion to waive the second reading. Are there any questions on waiving the second reading to the Ramsey County Administrative Ordinance? This is an ordinance that provides authority for our departments to issue administrative citations. It is coming from the Public Health Department. Thank you. There are no questions. I'm going to turn to the clerk to call the roll to waive the second reading for the administrative ordinance.
McDonough,
Aye.
McGuire,
Aye. Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Freda,
Aye.
Maris Castillo,
Aye.
and Carter.
Aye. Thank you very much. And now we will hold the public hearing. It is now open on the amendments to the Ramsey County Administrative Ordinance. This is a public hearing. There is no vote taken during the public hearing today. The public hearing is on the proposed amendments to the Ramsey County Administrative Ordinance, and it is open. The purpose of the meeting is to allow the public an opportunity to comment on the proposed amendments to the Ramsey County Administrative Ordinance. If there is anyone here to speak at the public hearing in person or on Zoom, when you are called to speak, please state your name and your city of residence before making your comments, and you will have a limit of 3 minutes to give your testimony. It has been noted by the clerk of the board that so far no one is signed up and on the list to speak. Checking with the clerk, is that still true?
That is correct, Chair Carter.
Thank you very much. As no one is signed up to speak, I will call to hear if anyone is here to speak on the proposed amendments 3 times. Is there anyone here to speak regarding the proposed amendments to the Ramsey County Administrative Ordinance? Is there anyone here to speak on the proposed amendments to the Ramsey County Administrative Ordinance? Once more, is there anyone here to speak on the proposed amendments to the Ramsey County Administrative Ordinance? I declare the public hearing is now closed. Thank you very much. So we will be voting on that ordinance at a future meeting. And we have the delight of moving on now to the presentation of a couple of special employee achievement awards. I am delighted to have the opportunity to call on Commissioner Fretham for our first award. Commissioner Fretham.
Thank you. I am honored to get to present the Employee Achievement Award to Bridget Martyr. Bridget is the claims administrator with risk management, which is now located in finance. She was nominated for a Ramsey County Employee Achievement Award in the category of personal growth despite adversity. And when she was nominated, she was in the county attorney's office. So Bridget makes decisions about settling or denying claims made against the county. Her job can be very demanding, and she often deals with residents who feel they've been wronged by the county. But she's known for her positive, can-do attitude and her good judgment in settling claims to ensure the county is efficiently using taxpayer dollars. In addition, she has given us permission to share that a few years ago, she was diagnosed with breast cancer. With appropriate medical care, self-care, and family and coworker support, Bridget elected to continue serving in her role during this time. And despite dealing with surgeries and doctor's appointments, she didn't miss a beat. She kept up with her work and family responsibilities and stayed positive throughout her treatment. This positivity was an inspiration to Melinda Dreschler, who nominated her for this award. Dreschler said that she doesn't know if she could have come close to handling the situation as well as Martyr did. Jenny Grosskopf, Martyr's current supervisor, said she admires Bridget for her perseverance and fortitude. Most employees in Martyr's situation would need to take a leave of absence or reduce their hours, but not her. And on top of her health situation and an ongoing pandemic, she also has 2 young children to care for. John Kelly, who supervised Martyr for 7 months, said she is well deserving of the award and added that her former supervisor, Jeff Stevenson, would agree. So in summary, the Achievement Award Selection Committee recommends that Bridget Martyr be awarded a Ramsey County Employee Achievement Award in the category of personal growth despite adversity.
Thank you very, very much for that note regarding our award winner. Are there people here to speak to the award? And in particular, is Bridget online with us?
Hi, I am. Thank you so much.
There we go. Okay.
Yes, thank you so much, Commissioner Fretham. I am so grateful for this award. I want to thank Melita for the nomination. So many people to thank in the county attorney's office when I went through this journey. It was very difficult, and the support and the flexibility that they provided to me was overwhelming. So I cannot thank them enough. Along with Jeff Stevenson, who is now retired, Stephanie Plody, my leave administrator, Yvonne Schneider, the HR person in the county attorney's office. I'm so very grateful for the entire county attorney's office for their support, to my friends and colleagues. I just can't thank you enough, for myself and for my family. Thank you very much.
And thank you so very, very much, Bridget, for being here to share your story. Clearly, the members of the department have appreciated, and this is a story of team partnership and your achievement in the midst of all that, given the great challenges you were under. Thank you so much. I do see Commissioner Reinhardt's hand is up. Commissioner.
Thank you. I just wanted to say congratulations, obviously well-deserved award, but I also want you to know that not just at this meeting, obviously, but to everyone that hears your story and understands where you are at right now, you are truly an inspiration. I want to thank you for that as well.
Well said, Commissioner Reinhardt. I think I saw Commissioner Maris Castillo's hand up. Okay. Well, we really appreciate the opportunity to share and hearing your story and to know the great strength that you exhibited, which is being recognized in this achievement award. We thank you for sharing and for enlightening the pathway for others as well. I just want to make certain that I'm not cutting anyone off who may be here.
Thank you so very much.
Once again, we applaud your achievement.
Thank you.
I now have the great pleasure of calling on Commissioner Reinhardt to present a second achievement award this morning. Commissioner Reinhardt.
Thank you, Madam Chair. And I'm hoping that Zachary Hilton is on the call. Oh, good. I'm seeing. Okay, because I know he was.
Madam Chair, Commissioner Reinhardt, he's in the chamber, so he's coming up to the podium.
Okay, great. I mean, I can say great things about him without him there, I suppose, but it makes him so much better this way. I have to tell you, before I read the information about his nomination, and I'm about to sneeze, that's not good, that there have been so many times where I know that each and every one of us on this board have said, well, we'll get you in touch with Zachary, and referring people to him that are in need. Anyhow, so Zach, I don't see you, but I believe that you are there in the chambers and can hear what I'm saying. So this is the nomination summary. Zach Hilton is a senior policy analyst in the Policy and Planning Division. He was nominated for a Ramsey County Employee Achievement Award in the categories of excellent job performance and performance beyond the call of duty. According to Policy and Planning Director Elizabeth Holzman, Zach always goes above and beyond, and we all know that, juggling multiple strategic high-impact projects at once. This includes organizing community workshops for improving community indicators and performance measures for the county. Zach is known for pushing beyond the status quo and finding new ways to adapt to meet goals. Tolzman said he is doing the job of 2.5 to 3 people, including supporting safety and justice, tracking performance metrics, conducting state data analysis, and facilitating meetings. And if you've ever been in a meeting with Zach, you know how great he is at that. Zach's brilliance lies in understanding systems and structures and understanding how to deconstruct them to reconstruct them in a better way. He also has a unique ability to bring in key stakeholders. Zach's colleagues, Prince Corbett, described him as very innovative and creative, adding a lot of people really love that he can think outside the box. He can challenge people in their thinking, Deputy County Manager Scott Williams described Zach as a champion for change and a great connector between the county and the community. He is also known as a team player who will give credit to colleagues before himself and helps his team in all they do. In summary, the Achievement Award Selection Committee recommends Zach Hilton be awarded a Ramsey County Employee Achievement Award in the categories of excellent job performance and performance beyond the call of duty. So with that, I would like to welcome Zach. Good morning.
Good morning, Zach, and thank you for being here with us. Congratulations on your award.
Thank you. Just to say a few words of thanks, Chair, Commissioners, everybody else on this call. I just wanted to recognize that Ramsey County has really become a place that I think could recognize someone like me and the things that I bring to this place, or the way that I've committed to this place. There are so many others that I think offer just more to this community and this institution. So I guess I'm looking forward to Ramsey County continuing to grow, to see more and more of the people that offer so much to this place. I do want to say thanks to definitely my team, the policy team, past and present, just for always being willing to show up and support each other and uplift other leaders. Elizabeth and Prince, for always being willing to take a risk and to consider doing the right thing. I started my career at Ramsey County, and here I am now. So huge thanks to Leah Bauer and Cam Counters and Dana DeMaster for letting me do the things that I wanted to do, even though they were usually against the things that I was expected to do. And then I want to just lastly say thanks to the leaders in the community, like Laura LeBlanc and Marsha Cressy and Damon Drake, Mary Kay Boyd, that have welcomed me into a community and welcomed me into their council. So, and then I said the last thing, just to reiterate, there's still much more work to do for Ramsey County to continue to grow as new leaders like Sia Zhang and Zakaria Nagatu, Abdul Aziz, join this space to begin to be great and continue to make this place a great place. So, thanks.
Once again, thank you so very, very much, Zach. You began your comments saying that Ramsey County has become a place that can recognize someone like you. And that might have sounded strange, but we know exactly what you mean. You are a positive system disruptor. And when we say community engagement and equity, you are moving us ever toward the pure reflection and demonstration of what that means. We appreciate that you dig deeply and that you help us to say what we mean and mean what we say. You are a great connector, and we appreciate the connections that you have drawn between the multiple sets of work that we are doing as we move toward equity in all areas and engage our community to bring that forward. Commissioner Reinhardt.
And I just wanted to note, you do all of this in such a, in many ways, a humble manner. You're behind the scenes, but as you can tell, we noticed because you do go above and beyond, and you're creative, and as Prince said, your innovativeness and your creativeness is noticed, and it's really added a great deal to Ramsey County. And so I just wanted to say that so that you understood that the work that you do and your team really makes a difference. Thank you.
Thank you. I think we all appreciate too the great manner in which you are a team player and you find the ways to work with your teammates and they find opportunity in working together with you, supporting you and gaining your support. So we thank you so very, very much for all of your work and we celebrate you today for this achievement. Are there other comments from board members?
Madam Chair, Prince Corbett has his hand raised, if you can see that.
Thank you. I didn't. And so I will call on Prince.
Thank you, Madam Chair and Commissioners. I had the honor and pleasure of nominating Zach. And if there was a picture that could truly capture what exceptional and model Ramsey County employee is, like Zach's picture would be right there. I remember when we first declared the COVID-19 emergency, Zach worked 10-hour days, including late evening hours as part of the IMT planning team. He was doing this while also leading departments and finalizing the 2020-2021 performance metrics. In addition, Zach has been a coordinator leader with the Bail Reform Work Group aimed at transforming our current bail system in the county. He also is a lead coordinator for our work with the Robina Institute work group that is working on reducing probation revocations. He also, and there are a lot of he alsos, as you all know, is a point coordinator for the work Ramsey County has been doing with the Burns Institute that is focusing on ways we can reimagine and reinvest funds into systems that produce more equitable outcomes as we really look at dismantling systems of racism and white supremacy to address racial disparities and racial inequities in Ramsey County. Zach does so much more to support leaders. Zach, to me, is more than a colleague. Zach, to me, is more than a friend. Zach, to me, is like my brother. So thank you all for the recognition.
Thank you so much, Prince. That was so well stated. I could have named a few of those, but I certainly could not have rattled them off in the way that you did to share with us how impactful Zach's work is together with partners in Ramsey County. So thank you so much for being here to make that tribute. Zach, I want to be sure to go back to you before we complete this congratulations and celebration today.
Just thanks again for everything. And looking forward to our board workshop this afternoon.
And we are too. Thank you so very, very much, Zach. We appreciate you. And we're glad to have this opportunity to have celebrated both Bridget Martyr and also Zachary Hilton today. With that, board members, we will move on to the section of our board meeting, which is our COVID update, and I will call on County Manager O'Connor for that.
Thank you, Madam Chair and members. Good morning. I will start as we normally do by turning it over to Public Health. And I see Director Holly and Dr. Ogawa here. And there's Incident Commander Anderson. If I just keep saying it, people pop up. So take it away, Public Health.
Thank you, County Manager O'Connor. Madam Chair, Board, happy to present some information to you all, the latest numbers for COVID-19. I'm going to ask Mike Lindsay to go ahead and start off by quickly opening up the CDC data tracker. Thank you so much, Mike. If you would go ahead and select for us Minnesota and Ramsey County, we'll take a look at our case rate and our positivity. As of yesterday, our partners at the Centers for Disease Control and Prevention reported a case rate of 367 per 100,000. This is a significant jump in terms of our case rate. As you all know, back in July when we started using these markers, we were sitting at 54 cases per 100,000. We see the same troubling metric when we look at positivity. Here in Ramsey County, 7.5% of all tests are testing positive. This is commiserate with what we're seeing across the 7-county metro, but it's definitely concerning. The majority of these positive cases are working adults. We're seeing higher case rates among individuals ages 30 to 50. And the majority, again, of these positive cases are occurring in individuals who are not vaccinated. Mike, could you go ahead and share our Ramsey County situation update next? Thank you, Mike. So as I noted last week, we will continue to be making some modifications to this particular dashboard based on MDH's newly released data on reinfections. I had a chance to look at this data along with our planning manager, Tommy Godwin. Here in Ramsey County, reinfections make up a tiny, tiny percentage of our overall caseload. We know that particularly older individuals in congregate settings, as well as healthcare workers, may be more prone to reinfection. Just a reminder, all of those individuals are interviewed. They are treated as a new case with every new infection, but they were not included in our prior data sets due to a lack of a standard case definition. Mike, would you go ahead and take us over to our Ramsey County, actually, excuse me, would you go ahead and take us to the Minnesota Department of Health vaccine dashboard? We're gonna take a peek at that first. I wanted to share just briefly a look at our vaccine numbers statewide. They're a little bit easier to interpret.
Excuse me.
Yes.
Madam Chair, as all I see is a spinning circle. If others are seeing the actual presentation, I'll just be quiet.
Yeah.
Is everybody else seeing the presentation?
No. Thank
Okay.
you.
No,
Thank you.
Commissioner,
Please address that.
I'll try to share my.
Thank you, Commissioner Reinhardt. I did not have that screen up at the time.
Yeah, I think we're
It
gonna
was
maybe
neat.
just have to, Madam Chair, I'd say to the staff, I think we should just go without the dashboard today. It's not, for whatever reason, it's not showing up correctly, and we can just talk it through.
Thank you.
Just-
We'll proceed.
Thank you guys, and thank you for letting me know as well. So just a heads up on what we're seeing with vaccine uptake. This past week, we had the opportunity to expand our audience of clients down to individuals as young as 5 here in Ramsey County. So you may recall last week we were sitting at about 80% of all eligible residents having received at least their first shot of a vaccine. This week we are sitting at 72% of all eligible residents having received at least 1 dose of a COVID vaccine. That is a decline I am willing to take. What that means is we are seeing a lot of young folks go ahead and obtain vaccine right away out of the gates. Thank you, Mike. I can actually see your screen, so I am assuming others can as well. Appreciate that. If we look at the numbers for 12 plus, again, 80% of residents who are 12 plus have received at least 1 dose. For the population who is 16 plus, more than 75% of those have completed the vaccine series. And if you would, yep, again, Mike, just scroll down and we'll take a peek at doses administered by our public health colleagues. As of yesterday, November 8th, we had given more than 58,000 vaccines at 405 clinics. We have received a little bit more than 64,000 doses. Those are part of that pre-booked vaccine dose process. Again, I believe I described that last week. We are filling up our pediatric slots quite quickly for vaccine. During the past week, we administered a little bit less than 250 doses through 3 vaccine clinics. And next week, we intend to kick up those numbers quite a bit. We will be providing approximately 400 doses to Ramsey County residents at a variety of clinics. And I think Director Holly will share a little bit more about that next. Thank you.
Thank you, Laura. Madam Chair, Commissioners, good morning. I'm happy to be back here. Mi-Chang, I think we can stop sharing the screen when you get a chance. So as Incident Commander Laura Anderson mentioned, we started offering our Pfizer boosters. I'll start there this morning on Saturday, October 9th, Moderna boosters on October 30th. And as of Monday, November 8th, we've given around 290 booster shots or 3rd doses. And we have about 268 scheduled over the next 2 weeks. So starting with our 3rd doses. We'll continue to offer our $50 incentive for those 1st and 2nd doses as a part of our vaccine initiative at our St. Paul Ramsey County Public Health sites. We have given out more than $95,000 worth of incentives since we started in early August. So we're really happy to continue to do that while supplies last. As Incident Commander Laura Anderson mentioned this morning, tomorrow we are happy to begin integrating our pediatric doses into 2 community clinics, starting with New Brighton in the Consulate of Mexico, where all of our appointments are booked. Probably no surprise to anyone here. And the following week, you'll see us at 2 of our St. Paul school sites. And so Como Park Elementary, Battle Creek Elementary. Again, all of the appointments are fully booked for our November 15th and 22nd at Como Elementary and at Battle Creek. We're starting on November 16th. But there is good news. I checked this morning. There are available appointments at these sites on November 29th at Como, and then the 23rd and 30th at Battle Creek. So hopefully those will fill up. They may not be there after we get off this call, but they were available when I last checked a few minutes ago. I also want to note that this is the first round of clinics, as we all know, that are focused on serving and really integrating our pediatric clients that have to have specific doses of the vaccine. So as we get started, I just want to mention we'll be able to handle more people at our community and school sites, including our 5 to 11-year-olds. So we're just kicking this off. We know that the appointments are filling up everywhere, not just at our Ramsey County sites, but we're really happy to partner with our continued community partners, both and our school partners. They've been amazing during this time. So thank you to the community for partnering with St. Paul Ramsey County Public Health. We are also working to identify a few trusted messengers or partners to host a few pediatric community pop-up vaccine sites in communities where we know there's a great need. And so I want to recognize that this morning, that we know that we want to get in front of any of the inequities that we saw at the beginning of when vaccines became available to our entire state and nation. And so we know that just with the work that we've been doing around race equity as a county, our community engagement work, our COVID-19 response with research, and that partnership with public health, that we want to continue to leverage those relationships and work with trusted members of our community to now administer and provide those pediatric doses to our kiddos. Public health is, I'm happy to say, is always partnering with communications, and very soon we will be sending out a direct mail piece that is excellent. I want to thank John Sigvelin and his entire team for that continued partnership. That direct mail piece will go out to thousands of Ramsey County residents that have families and kiddos in that age range. And so we just really want to make sure that we're reaching our families with kids 5 to 11 and above, and letting them know that we're here to provide vaccines and to be of service to our community. So we're really excited about that opportunity to continue our promotion, our engagement and outreach as a public health department. Public health, as always, is partnering with research. We are looking to extend the contracts of our trusted messengers. We're working in partnership with procurement and the back office team to do that as we speak. So we're really grateful for that opportunity to continue that important work. As the county board approved that RBA back in September, we just wanted to provide a quick update that we are extending those contracts so that we can continue that important work with our trusted community connectors and messengers. In that, we're really going to focus on reaching the whole family, of course, reaching our kiddos 5+, and then also getting information out around vaccines and regular testing. So thank you all for having our public health team, and I want to turn it over to Dr. Ogawa.
Thanks, Treasurer Holly. Chair Carter and commissioners, I actually wanted to highlight a poll that one of our planning managers, Tommy Godwin, and our Medical Reserve Corps coordinator, Brian Brown, did at our Arlington and Oxford sites recently. A little more than 200 individuals. They asked as they were leaving, what helped you get over the hump to come in and get a vaccine? And hands down, the highest or the most common reason that they came in was because someone they trust, a friend, a healthcare provider, faith leader, encouraged them and was supportive of them. To me, that speaks to all of the work that public health has been doing over the past year and a half, and even before. We recognize that Ramsey County has been working to become a community partner, right? And be trusted on some level. And our work with trusted messengers, our work with communities is showing that we can be a trusted partner, which is exceptionally important and wonderful. Second, after that, was employee requirement, which also is interesting. And we've had lots of conversations about how we help individuals protect themselves and their family, and what are some of the better ways that we can support them in making those decisions. And then third was the gift card. So we do know that that has some effect as well, and that's why we're continuing to do all three of those approaches, as well as other ones. Other things that we asked about were Food and Drug Administration approval, social media, and other things as well. And so, but I really wanted to highlight that I truly believe, and I'm exceptionally proud of the work that we as public health have done in getting the message out there in a way that is receivable and trusted and working to get individuals who even now we're having some time in our decision in getting the vaccine. And so I just think it's some really good information. I look forward to also, just as Director Hawley highlighted, continuing that outreach, continuing that connection to community, and continuing to get vaccines in arms. Thank you.
Thank you, Doctor, for that information. It's great to get to hear some of the different efforts. Madam Chair, I'll wrap us up with some data on our vaccine and testing numbers. My goal is to bring this back over the next couple of weeks.
Excuse me, before you wrap up, may I ask for a question from Commissioner Matis Castillo? I see her hand is up, perhaps on the information already shared. Commissioner Matis Castillo.
Yeah, thank you, Madam Chair. And thanks, County Manager O'Connor, for letting me bump in. It's not really a question, but I really just wanted to make a comment again, because I think it's important that we really understand how great our team is at public health, and to think about the longevity of this pandemic and the endurance it has taken, and especially Incident Commander Anderson. You know, we often get really excited about Dr. Ogawa and her knowledge, but you are behind the scenes holding it all together. And I just wanted to take a moment to celebrate you a little bit as we had our Employee Achievement Awards today. It made me think that it's an opportunity and time to say thank you for your hard work and endurance. It has been a long pandemic, and you have continued to show up, keep things going. I hear from your staff how great of a leader you are, which is truly, really, that's when you know the mark of a great leader is when their staff are excited about them. And so just wanted to give you a little love there too. I had the opportunity to take my youngest kiddo to get vaccinated at our family practice clinic, which is a professional clinic that does this all the time. And I will tell you, it was sheer chaos on Saturday morning. They were disorganized. People didn't know what was happening. And I think that's what they do. That is their one and only mission all day, every day. And every clinic I go to that is a Ramsey County clinic is organized and effective. And so I just wanted to say the contrast, the professionalism, and your endurance and leadership is really remarkable, and just wanted to take a moment to say that. So thank you very much, Incident Commander, and to the entire public health team.
I think that was worth the interruption. Thank you, Commissioner Matis Castillo, and thank you again to you all. Brian.
Thanks, Madam Chair. I'll just finish the update piece before questions with the information on the vaccine and testing numbers. You know, I want to keep bringing this in for a couple reasons. One, so the board has an understanding of where we sit. Secondly, the state of Minnesota, counties across the state now are working to better understand the federal requirements coming down in early January on vaccine and testing. And we are on the vanguard of that and provide opportunities for others to be able to learn from the experience happening here as they implement, which benefits our employees and benefits us as well. The more people vaccinated everywhere, the better off we will be in having life return to a world where pandemic is not in every sentence that we use. So we have 4,974 employees. That's permanent, temporary, intermittent, and seasonal, all who are eligible under the policy that was passed. 3,376 have so far certified their vaccination status. That's 68% of our total employee population. It's up 5% from last week. I'll talk more about what about the last third? And I'll come back to that. But of the 3,376 who have certified status, 91% are vaccinated or have certified and uploaded proof of vaccination. And then 62%, so that would be, if you took that across all 4,974, that means 62% of the total employee population is vaccinated. That would be our floor at this point. So everything goes up from there as we move ahead. We have 1,653 employees left not certified with their vaccination status yet, either way. We have had 244 test results submitted since November 1st. 168 results were submitted for the week even from October 30th to November 5th. And the full first week of testing implementation expectation started with between the 6th through the 12th. So we're in our phase now of where the requirement begins to take teeth this week. There was kind of a ramp up and now we're fully in. The two notes from the tests, we did have 2 positive tests that came up through the process, which prevented COVID from potentially getting into the workplace twice. And every one of those instances matter. And I love Dr. Ogawa nodding her head emphatically at that. And so we immediately become a safer organization through the policy and stopping spread and getting vaccinated. And then we did have 3 exemption requests so far that have come in, 2 of which were able to be accommodated through the testing policy, and 1 was granted after evaluation. So I want to share that just as a part of giving a sense for, we do not have widespread exemption requests coming in. We generally are seeing high rates of compliance with vaccination among those who have submitted. Testing has done its job so far a few times and will continue to as we go forward. All of these are important. So I want to end on we still have 1,600 individuals eligible under the policy who had not yet uploaded as of last night when we pulled our data. One part that's a little more speculative than anything else, but just recognizing it, we frequently say we have about 4,000 employees. The other 974 become temporary, intermittent, seasonal. I do think you're going to struggle to get the same level of compliance across everyone there, because they just might say, it's not my season anymore. I don't really, I'm just in a spot of voluntary non-compliance because it doesn't impact like my day-to-day. May not be checking email, all those things. So we're going to expect some potential group there that will try to reach out, but they're going to have less incentive to need to respond in any near term, just based on the current status. Then within that, though, we still have about 600 to 700 employees that I would say are more of the group that I would expect need to respond quickly. This is the week where we're using education as the first step of a graduated approach. And starting next week, it'll move to the next step in that approach. And so for anyone thinking, are we serious? We are. And we are trying to show grace during a ramp up period and recognizing there's a lot of information. Some employees, even through all the information going out, had not seen as much as of last week. And so education is this week's step, and then we'll move forward from there if we continue to have challenges. So I hope to bring back numbers next week that show our numbers keep bumping up. And I want to thank everybody. I've gotten a lot of feedback from across the organization, enough to where I haven't been able to respond to all employees yet, but some are saying, why even allow for testing at all? Others saying, why do anything at all? And most falling somewhere between the two, saying, I'm really glad that I'm coming to work in a place where people want us all to be safe. And I think that's what's important for the board to hear. So I'd be happy to answer any questions on that. The county board, per the request here and through the conversations we've had, are set to consider a request for board action next Tuesday that will expand the policy to cover all elected officials within Ramsey County's ecosystem as well. So I'm putting you all on notice. No, in all seriousness, that'll come forward next Tuesday, and looking forward to that as well. Thank you, Madam Chair, for letting me add that data in. And and my last piece, I'm sorry, I'm going to read these real fast. A week ago, there was a request who was involved in the different teams of all the different implementation on November 1st. Thanks go out to Elizabeth Tolzman, Joanna Berg, Jean Kruger, Alex Kutza, John Sicklin, Sandy Blazer, Cassie Fitzgerald, Sia Zhang, Deanna Pesnick, Jolie Wood, Mi Chang, Lydia Gurmo, Renee Vogt, Allison Kelly, Laura Semp, Cindy Robbins, Eric Brown, Kirsten Schultz, Daniel Schmidt, Jennifer Schreffels, Chris Bogut, Allison Winters, Kathy Adine, Sarah Holly, Laura Anderson, Lynn Ogawa, Jean Kruger, Elizabeth Tolzman, Deanna Pesic, Jolie Wood, Alex Kutza, John Sickflin, Chris Burns, Elizabeth Brady. There's a whole bunch of people that start to show up a second time, third time. Tammy LaFord, Antonio Montez, Carissa Helt, Sandra Hokinson, Jean Grambling, Amy Janetto, Aletha Mohammed, Jennifer Otley, Richard Hammonds, Jennifer Chang, Tina Javinsky, Melba Holmes, Stephanie Gunther, Emily Kamel, Aldona Bacon, New Chang, Miriam Simpson, Tammy Rattay, Allison Gilbert. I probably missed a name, but it gets to the sense of how many people were involved behind the scenes. Thanks for letting me do that.
Thank you. Thanks to all those names and more who I know have been connected to this effort. It's not a simple task, but it is teamwork that makes the dream work. So thank you to our team. I did see Commissioner McGuire's hand up earlier, and you are back up again. Thank you for your tolerance, Commissioner McGuire.
I wanted to hear the county manager's report, and then I wanted to just make a few remarks and ask a couple of questions, Madam Chair. Thank you so much. I want to echo Commissioner Matos Castillo's, gratitude to Incident Commander Laura Anderson and all the great work that she's doing, and of course the whole team with Director Holly and Dr. Ogawa. It's great to be recognizing people as we did this morning, and sometimes, and it doesn't diminish from all the great work that a lot of people are doing, that we could be giving awards to a lot of different people. And sometimes people are so busy, they're not putting in for awards. So I'm looking at the public health team as that. They're so busy doing their work. We'll be looking for lots of awards to be given to your team. Madam Chair, I just have a couple of questions because we've been all hearing the news about, the rise in breakthrough cases, and so and they said, so don't get lax about wearing your mask, and be careful about the groups of people that you're going into. So we are heading into a holiday season. So I was just going to put Dr. Ogawa on the spot and ask. We're planning to be together at Thanksgiving. My family, we're all vaccinated. We're all getting our boosters now as we can. I mean, the young children, if they can they're getting vaccinated. So, do we need to wear our masks indoors, do you think? Or what are you recommending? And, my mother's 94. Do we not have her go to these events? What are you thinking?
Chair Carter, Commissioner McGuire, you're certainly not the first person who is asking me these questions, nor will you be the last. And I don't mind being put on the spot at all. So there, and you know how I love to start with quoting a study. There was a good study out of the Netherlands that looked at cases between February 2021 and May of 2021. It actually looked at the efficacy of transmission, essentially how the vaccine reduced transmission, okay? And for Pfizer and Moderna, the numbers were still very good in the 70 to 80, 85% range. Having said that, if you're going to be meeting with a number of family members who don't normally see each other, or individuals who are high risk, and individuals who aren't fully vaccinated or partially vaccinated, and or potentially have been exposed a great deal, that's still risky. For every family unit that you introduce a higher risk to, that increases the higher risk for everyone. So masking is a mitigation effect that we know, and so may be employed. Testing is a very important mitigation as well. And so even if individuals are asymptomatic, some consideration of a test right before, and then staying separate and reducing the risk of exposure before meeting together might also be a good mitigation effort employed as well. So those are my answers that I'm telling people. Again, I want people to be able to get together. Vaccine, huge reduction, but not 100%. And for our family members who are at high risk and our family members who are not fully vaccinated yet, we really need to be careful.
I really appreciate that. I really appreciate that answer. And right, I'm glad we're continuing to stress, of course, the vaccine and now the booster for those people that can get that, and our younger people are getting vaccinated. So we're all going to keep doing that, of course. And I think we will just mask as people are masking when they come to visit my mother, because it's just safer, even though everyone's been vaccinated, we just want to be as safe as possible. So I really appreciate that. And thank you again for all of your work. So appreciate it. Thank you, Madam Chair.
Thank you for the question, Commissioner. Commissioner Reinhardt.
Thank you. I have a question about, well, first of all, myself and my grandchildren all went to River Center on Sunday afternoon and got tested because we had been exposed, all three of us had been exposed to someone who tested positive on Saturday. It was interesting. It was, the person was in their 20s, fully vaccinated, always wearing a mask, always doing everything above and beyond. And so it just shows that you just never know. And so hopefully his case will be very mild because he has taken all of those precautions. But my question is, and one of the, even though I have some tests here, I did not use them because I had appointments yesterday and they were supposed to go to school and they did. So I knew that I needed to get something that could really prove that they had tested negative. So that's why we went there, even though I could have done it at home. So my question is for our, and this is probably more for Ryan, for our employees, do they have the option, or how do they get tested now? Because that is an added step, which is incredibly important, and I cannot imagine how surprised the two individuals that tested positive were at that diagnosis. But how do we enforce that, or does it have to be done at? Tell me more about how it's done, so that we can verify it.
Madam Chair, Commissioner Reinhardt, thank you for the question. I'm going to do my best, and if I get something wrong, I'd ask Public Health to back cleanup. This is always a good test for me. There's a lot of new policies rolling in all at once. So first, in terms of how we know and seek compliance, next to the vaccination upload status on an employee's page on our Summit system, our employee information system, there's also a testing page option. And so you upload the results directly into our employee data system, which ensures data security and medical information only shared where it needs to be and all of that. So that's how you would do it. There in the policy is defined types of what is an allowable type of test. Any of the tests you would get at any of our regular testing sites would count as a part of that. And I don't know about exactly how like an over-the-counter take-home test would be covered. So at the end, okay, Dr. Ogawa, if you could answer that part for me on the fly, that'd be great.
Yeah, what was entered into the policy and what I supported, we supported as Public Health, is that it needs to be a lab-run test. The take-it-home ones are reasonable. They're antigen tests. We're actually accepting antigen tests. They just have to be run by a lab as well. There is the risk of user error on the take-home ones, not, and so we felt that it needed to be consistent and interpretable. And so some of the take-home tests you can mail in. And so it could still be a take-home test. It just has to be processed by a lab.
Thank you, Doctor. And then the final pieces to that I would just add, all the Vault Health options, the at-home mailed test, which you can get for free through the web, through the MDH site, the sites to visit, whether rapid or a saliva test, all of those work. And I believe we are the largest employer in the state that Impact bargained with our unions around implementation of testing. And that's something we should all be collectively proud of, that we came together to work this out. There are provisions, both how time would be recognized during testing, as well as if time cannot be used because of a service interruption, how do we take care of that piece as well? Final piece is we do continue to evaluate on-site testing options based on need, or because it actually helps everybody from the organizational side and employees. Again, our goal is not to set up the most complicated testing apparatus. It's to get everybody vaccinated from COVID. But getting people tested is the next best thing to do as we go. And so as the numbers increase that have registered, if we see areas where it seems like there's a preponderance of individuals who are not vaccinated, we're looking at like on-site options as a temporary piece to how we bridge some of that. More to come in the future if we go down that road. But right now, Volt Health is our backbone testing approach.
Thank you.
Thank you very much. Commissioner McGuire.
Yeah, thank you, Madam Chair. I had another question that I wanted to ask Dr. Ogawa. We haven't really talked about this, but I was at a Aspire event the other day and they gave out infrared digital thermometers. So this is, the no contact testing. And I thought, well, I was also at a couple of events the last few weeks where they, before they let you in the building, they took your temperature. So I know that people are doing that. I was just wondering if you wanted to comment on, maybe we should just test everyone at our Thanksgiving dinner before they walk into our door, my nephew's door, I will say. But I'm just curious if you want to comment on these digital thermometers and how effective they might be.
Chair Carter, Commissioner McGuire, I'm happy to comment and unfortunately burst a little bit of a bubble. There's been a handful of studies that have looked, not specifically with COVID, but even before COVID with Ebola. Actually, there were some really good studies that looked at monitoring temperatures ahead of boarding planes or going into businesses. And what they found was that it was not indicative of actually individuals who were infective. We in the beginning of the pandemic, we knew that individuals who were symptomatic were at much higher risk for transmitting the disease. But we also learned shortly after that is that even 48 hours before people are symptomatic, they are able to transmit the virus as well. So as much as it would be nice to utilize that as a perfect indicator, it didn't pan out to be quite as predictive as we had hoped. So they're still very good ways to measure temperatures in general, but as a screening tool for potential infectivity associated with certain infectious diseases, they haven't been as helpful. Sorry.
No, I appreciate that. Thank you very much. I was just surprised when we're giving them out at this event that I was at. So thank you for that. And I just wanted to make one other comment that I know I just appreciate all the outreach that we're doing to get our kids vaccinated. And I know that Roseville Area Schools has a couple of sites too. So in addition to Ramsey County sites, which I appreciate, the ones that we're working on, that our schools are obviously working on their own sites and they were doing that directly with the Department of Health. Is that correct? They're just not doing it through us, but kudos to everyone who's trying to get a vaccination site in their area.
So thank you very much for the questions and the responses and comments. I'll go back to County Manager O'Connor to close out our COVID update.
Just thanks, Madam Chair, for the questions and discussion and to the ongoing work of the public health team.
All right, thank you very much. Let's take that 30 seconds of reflection. We are continuing to focus on diligence as we work through this experience, elongated as it is, and at least for this short period of time, a 30-second reflection, moment of meditation. Thank you for the pause. I'll turn to Commissioner McDonough to take us through our administrative items, Commissioner.
Thanks, Madam Chair. I'll move item number 6 from Safety and Justice, Joint Powers Agreement for Metropolitan Emergency Service Board. Item number 7 from Workforce Solutions, grant award from Minnesota Department of Human Services for supplemental nutrition assistance program, employment and training. And item number 8 from Workforce Solutions, Minnesota Family Investment Program Biennial Service Agreement for 2022 to 2023.
Thank you very much. Thanks. There's a motion and a second from Commissioner Manis Castillo. Are there any questions on those items? Then we'll have the clerk call the roll, please.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
and Carter.
Aye, and thank you. All items on our administrative agenda have passed. We'll move to the policy item, which is a presentation on the American Rescue Plan Act funding request for Tier 1 priority administrative items. This is for information and discussion only. I'll take a motion to get it on the agenda.
So moved.
Second.
Thank you. There's a motion and a second. And I don't know why I did that because we don't have a vote. But let me call on our County Manager O'Connor.
Thanks, Madam Chair. We appreciate the preliminary vote of confidence. We'll go with that. This one is going to look a little different. Director Kutza is going to join me here from Finance to briefly explain the component parts of this proposed ARPA investment. At a broad level, it's an amalgamation of many of the different threads coming together. It's not a unique programmatic discussion like some of our other policy ones, but we're still moving this RBA in the same way so the board can be deliberative and have it a week to be able to hear from the CFO, and then we'll bring it back next week as an action item. We'll take specific questions if you have them. Hopefully, in many cases, these are not surprises, but move forward on items that we're regularly discussing as they've been Tier 1 pieces throughout ARPA. The final thing I'll just say on the way in is Director Kutz and I have already been going back and forth talking about this a little. We're going to pull together with communications like a one-page summary of all the different committed ARPA investments from the county, whether the money has even gone out the door or it's been committed. Because one of the biggest questions we're starting to get is it's hard to track the different investments, where they sit, what does that prioritization mean? And while it's written here in summary, we're going to do an easy visual on that. So that'll be a piece of homework coming out of today. I will turn it over to Director Kutza.
Thank you, County Manager O'Connor and Madam Chair. First, I want to just take a moment to thank all the people who helped me pull this together with all the different pieces. We have, public health and areas within health and wellness and the homelessness work and the county attorney's office, and many people helped, and they are all here also to answer questions if you have detailed questions that I can't answer at the end. So this request for this policy presentation today that will lead to the request for board action next week includes, as Ryan said, a number of items that cover kind of Tier 1 administrative priorities in terms of implementing the American Rescue Plan Act funding. So overall, the county has received just over $53 million. We received that payment last April. The total amount of money that we will be getting is $106.9 million. And those funds can be spent, they can be obligated through December 31st, 2024 and spent through December 31st, 2026. I always like to remind people so that we're all just kind of level setting on where we are. So far, the county board, as County Manager O'Connor mentioned, will be doing a summary kind of online with communications of where we are. But so far, the board has approved $2.1 million for the Right Track Workforce Plus or Workforce Initiative, $20 million for Affordable Housing Initiative, and $2.7 million for the Racial Equity and Community Engagement Response Team. In addition, you've seen the violence prevention, which is in a workshop this afternoon and will be coming forward through an RBA in the future in the next few weeks. And the proposed budget includes just over $20 million of ARPA funding.
So to quickly summarize the areas within this request, which totals approximately $11.2 million, the first $2 million is dedicated to public health, with $1 million of that funding going for immediate needs and of the department and the community, including things you heard about earlier from the public health team, like the vaccine incentive program, sustaining some of our limited duration staff to make sure that these vaccine operations, as Commissioner Modis Castillo raised up, continue to be just as smooth as they have been, to provide mobile testing and other important public health services, and work with our community partners and key stakeholders. The second $1 million in public health is kind of going for short-term and long-term recovery efforts. So things like increasing awareness and access to critical public health services, continuing to build capacity and provide public health education, and working to address emerging public health crises that have been exacerbated during COVID-19. The next section in the RBA is on homelessness, and it is a $5.1 million investment. If you remember back to last January, you all approved up to $20 million in CARES Act funding to go into a project to continue our efforts around the homelessness and shelter initiatives run out of EGCI and the homelessness project. We were able to transfer $17.9 million of CARES Act funding into that project at the closeout, and we are now returning to get the additional $2.1 million to make it up to the $20 million in the project that we discussed earlier. In addition, we're adding $3 million based on the needs, the funding to continue the shelter support, the benefits navigation, the housing search services, and other needs within the homelessness project. And so the total request here is $5.1 million. The third item is administration. I know that's a fancy title. So that includes $2 million, and it's really focused on the operational support services and the work we did in CARES, such as contract monitoring, technical assistance, program evaluation, subrecipient monitoring, and general contract services for review and audit of the requirements within the ARPA funding, including the reporting and all the things that we are required to do to receive this money. This includes also a program evaluation team that we're still working on that is similar to the CARES evaluation team, and we plan to return to the board to present the plan in a workshop in the future about how we're going to roll out that program evaluation. The funding is here to do that. The next section is in direct care. As you all know, the Lake Owasso residents and the Ramsey County Care Center have had significant impacts due to COVID. This funding of $1 million is to help offset things like day treatment being closed for a period of time and having more staff at LOR to provide day services for clients, and many additional staff needed, particularly at the care center, to satisfy the requirements of COVID screening at the door, scheduling, escorting, all of the additional things that are needed in a direct care facility during COVID. And finally, in the county attorney's office, there's $1.1 million request, including 5.2 FTEs. And this is really to enable the Ramsey County Attorney's Office in partnership with its second judicial district partners to work through the felony case backlog. This is not a problem that is specific to Ramsey County. This is something that courts and county attorneys are experiencing all over the United States. And the backlog is significant and would take years to address without this influx of resources to try and address it sooner. So overall, as I mentioned, that's an $11.2 million request within those different areas that will be coming before you next week. And I'm happy to answer any questions.
Thank you very much. I see Commissioner McDonough has his hand up. Commissioner McDonough.
Thanks, Chair Carter. A couple comments / questions. So I appreciate, Brian, you talked about it, and Alex, I think you confirmed, as we're getting money, ARPA money out the door, we're, trying to make sure that we're being transparent about it and getting that out to the community. It occurred to me, and I don't know if this makes sense, and I don't want to add a ton of work, right, that maybe doesn't have any value. But it occurred to me it'd be interesting and maybe helpful to connect back to CARES funding also. And I'll give the example, like in homelessness, we committed 20 million. Now if CARES, now we're taking ARPA money, to fill that gap of that commitment, but then we're putting another 3 million on top. And the reason I raised this is I think it would be helpful. The CARES funding really was going out the door fast, immediate impact, crisis driven. Clearly with the 5 priorities and really emphasizing deeper into the priorities to have some sustainable long-term impact. And making those connections, I think, is important. So the connection there is the 20 million in affordable housing, where we're trying to get ahead of and have a long-term sustainable problem, utilizing these 2 different pots of money that we've gotten from the federal government. So Ryan, I see you shaking your head. I think you're getting at what I'm talking about. I don't want to make a ton of work, but I think if this makes sense, could we maybe have that as a part of the report out so we can see, where there's still the crisis, and we're making sure that tier 1, but is getting as much of this money farther down where we have a lasting impact to really truly make that bigger difference. That's the first question. I have another one, but go ahead. I'll let you comment.
Madam Chair, Commissioner McDonough, because of the documentation we did before, that's actually not hard for us to do. It's more of just thinking about that through line all the way from the beginning to now. And we'll do that. I understand the value in that. I see that. So I appreciate the suggestion. The one other thing it does that I know all of you get asked these things too, this RBA highlights the ongoing emergency. And I just think sometimes people forget that COVID is an ongoing emergency for a social safety net provider. And it's this very stark reminder to us of we are not through it, only able to look ahead. And a lot of community requests for ARPA funding continue to come in. I know they come into all of you. And it's important for us to share and show our work so that people understand we're often not saying no because we want to, and it's not because of an illegitimate need. It's just because the needs are very great in the moment. So I appreciate the feedback.
Good, thanks for that. Appreciate it. And then my last comment or observation, and Brian, I seen you were shaking your head when Alex was talking about this. Probably no surprise, because I really made a lot of comments when we were getting the evaluation reports from the CARES funding, and I just thought that was so really a big step for us. And I'm glad to see that we're going to carry that forward, and we're going to take a look at how that we build off that evaluation process with the CARES dollars, now with the ARPA funding, to even strengthen that evaluation. And I talked about this when we were getting those reports, but my hope is we're building off of what we're building here, so that eventually this becomes the evaluation piece becomes a much bigger component into the budgeting piece, especially around the success indicators and performance measurements, where we actually use, documented evaluation to help us with those, help us get a better understanding of the impact our budget is having or not having. Because sometimes we think we're making the right calls, but we're not always getting the outcomes or the success we would hope. And the earlier we can catch that, the better off we can adjust.
Madam Chair, Commissioner McDonough, yes, this is meant to be that launching off point. It's not just something we want to tie to ARPA investment specifically. And that's why Director Kutza mentioned a workshop to be a little more thoughtful in how we talk about the go forward. I will just share right now, and this is not meant to be anything more than just how we're thinking about these in real time. On the list of sustainability priorities right now, affordable housing and emergency shelter and figuring that out is number 1, because the deadline for that starts as the snow melts next spring. Number 2 will be tied to the workshop this afternoon around violence prevention and long-term sustainable support models and responses. Number 3 then would be this around evaluation. And I think the goal is you have to walk, chew gum, and dance or skip at the same time or something to have 3 things going at once. But I just want to highlight, those are the three in my mind that I'm most wanting to figure out sustainable solutions, and appreciate your ongoing help.
Well, if anybody can demonstrate that walking, chewing gum, dancing, and a multitude of other things, is Zach, who we recognized earlier in the meeting, and I think Ramsey County is getting really good at that. So thank you. Thanks, Madam Chair.
Thank you, Commissioner McDonough. And we really do appreciate the manner in which you have rolled out the investment opportunities and shared with us in a very, very planful way, including in this presentation today regarding the administrative items that are Tier 1 priority. So I want to thank you, Director Kutza, for all of your planning and support of all of our areas on the presentation today. I will check back in then with Director Kutza and County Manager O'Connor for any closing comments.
I'll give the final word to the CFO, Madam Chair.
Thank you, Madam Chair. We will be back for approval next week. Appreciate all the work you all have done to be thoughtful and planful in this effort.
Much appreciation. And so again, there is no vote on this item. We will see it again in our board meeting for approval on next week's agenda. We appreciate very much the presentation, and we are going to check in with the county manager for county connections. We have a little time for that and for board reports before we conclude the meeting and prepare for our morning workshop.
Thank you, Madam Chair. I have three updates for the board today. First, you received an email update from Director Collins near the end of last week. And I think you got one then on Saturday that it's officially up on the web under our doing business ARPA contracting opportunities. But there is currently an open solicitation until November 15th around multifamily projects that have affordability requirements down to 30% area median income being a part of those projects. There are a couple of tiers of both trying to preserve existing housing as naturally occurring affordable housing, as well as new project development and be some of the final dollars in to make these projects go. This is the first of multiple solicitations you will see directly related to the $20 million ARPA investment in affordable housing that the county board previously allocated. So exciting to do the through line connection back to there. It takes a huge group to be able to pull these things off. So thanks to Max and Jules and CED, Stacy, Amy, Tara, Kim, and Alex on the ARPA compliance team, and then Dejan, Megan, and John over in communications for getting it out. A couple of then good news story pieces that I wanted to share. Ramsey County Library was recently notified it was awarded approximately $58,000 of emergency connectivity funding made available through federal ARPA dollars, specifically for schools and libraries, that is made to address technology connectivity gaps, which has been a conversation that we have been having around the table here since the very early days of COVID-19. The library collaborated with Workforce Solutions and St. Paul Public Libraries to develop a program that will fund hotspot equipment and internet access for approximately 600 young adults with children who are on MFIP through the end of June 2022. The program works to strengthen the connection to libraries for the purpose of promoting literacy. St. Paul Public Library received $160,000. Rollout's going to start almost immediately in the coming weeks. And then finally, I'm going to read to you a couple paragraphs from a testimony. I just got this morning. It's got to be a late ad. It's a great late ad. The Right Track Plus program that brings in interns, young people, to spend time in our system and be exposed to government in ways they may never have been asked to or afforded the opportunity to do before. Just this morning, from one of those interns, our Director of Workforce Solutions, Ling Becker, sent one of the testimonials back. And this is an intern who spent time in elections. And I'm just going to put it, I don't have the intern's name and I wish I did. So I'll just say, to the anonymous intern who shared this information, I'm going to share your words here today as a highlight of why this matters. Through the internship in Right Track Plus, I've learned a lot of life skills, civic skills, and have created a stronger tie to my community. I was placed as an office intern at the elections office. At first, I was hesitant about this. I thought, what could I, a business major, learn from an elections office? My second thought was I didn't even know election offices were a thing. Little did I know how much I would learn during my time here. I was thrust into training during my first few weeks to prepare for the municipal and school district elections. Yet, even during this hectic training period, I always felt a sense of familiarity because everyone made sure to treat me like this was home. I enjoyed learning about elections and everything that goes into it. I also learned how much work this small team of people put in every year to ensure we fulfill our right to vote securely, that we always have the access to vote no matter our circumstance, and that we go through this process as smoothly as possible. I was in awe. I never felt so proud or happy to be working at an office as much as this one. I'm even considering becoming an election judge next year for the election cycle. Yeah, let's get the name and let's figure that out now and lock that down. However, the most memorable moments of this internship were always with the people I had the privilege of working with. The real enthusiasm and care that each of these folks brought with them both impressed and surprised me. In the end, we all appreciate the election process. As a group, we just clicked. Even if I was the quote unquote baby of the office, nobody actually cared about my age or anyone else's. Why? Because at the end of the day, everyone pitched in to ensure that our office had a productive day. Getting to know each of them throughout the course of the day was an extra added benefit during my experience here. Through this internship, I've learned about healthy, cooperative work environments. I also learned about teamwork, friendships, and the election process. I can't say it better, so I'm going to leave it at that, Madam Chair, and say that is the good work that we want to do. And thanks to this board for their support of the Right Track Plus program and every staff person who made that the culture for our organization.
Thank you so much. It's a joy to hear from a young person who spent time with us and shares that feedback with us as to the experience that was had. And congratulations to our libraries also. That too will support our young people in their ability to connect in. So thank you so very, very much for your update. And I am going to turn now to other members of the board or to our board members for updates as well. I'll begin with Commissioner Ortega.
Thank you, Madam Chair. I had the pleasure of testifying before the St. Paul delegation on the River's Edge project for Ramsey County, Riverview and the Rice Street Transitway. I want to give a shout out to Jennifer O'Rourke for doing a good job. She worked hard at making sure that we got onto the agenda and was actually limited agenda. So we got in and she did a great job. The other thing is the Landmark Gala, which I attended in person, and it was a lot of fun with Commissioner Trista Mata Castillo. I'm only remiss that I didn't ask for copies of pictures from Trista. So she was dressed very 1980s. But it was a great event. As we all know, the money raised from this fundraiser all goes through the programming in Landmark Center. In Landmark Center, basically, 95% of the tenants are all nonprofit arts organizations that provide a lot of services to our community and opens doors to the arts and other things. So I'll leave it at that, Madam Chair. Thank you very much.
Thank you very, very much. And thank you for representing us also at the gala. I should have started actually with Commissioner McGuire. Let me round back. Commissioner McGuire.
Oh, thank you. Thank you, Madam Chair. I appreciate that. I was at the gala, but I was in a virtual capacity. So I didn't get to see the great outfits that were there. So, but kudos to Landmark for putting on a hybrid event. And I guess we'll see what the outcome of that was. But I was able to see all the auction items and to bid on all of those. And so I hope they did well in their fundraising efforts there. Just want to thank County Manager O'Connor for reading that amazing letter from the Right Track employee. I'm just so grateful to people who actually write letters like that when they've had an experience like that. And just thanks for sharing, and kudos to the elections team for creating an amazing work environment for that intern. I'm going to start out with a little bit of a legislative update. As I've been saying, our team continues to meet with Government Relations Director Jennifer O'Rourke and Melissa Finnegan and Commissioner Mattis Castillo and myself. And with our government relations consultants. We meet weekly and just have a lot to talk about. It's amazing how much is always going on, even when they're not in session. In fact, we all know this, that a lot of the work gets done before session happens. So, and we know that a lot's going on, thankfully, and well, we wish a lot more was going on in Congress, but we do know that this week, the Congress passed the bipartisan infrastructure bill, and it looks like Minnesota may get $5 to $6 billion. Ramsey County is going to see some of that, but I'll just note a few of the items that are going to be in that bill for all of Minnesota. Funding to address the 6 to 10 million lead service lines still on the ground across the country, and funding to combat the threat of the PFAS pollution and to make improvements to waste management and recycling systems. This is in addition to the investments in the traditional roads and bridges and internet. So just thanks to Congress for passing that bill that will help Minnesota and also Ramsey County. So next week, following with the legislative work, the House Bonding Committee is going to tour Ramsey County and St. Paul projects on Wednesday, and other bills for local Ramsey County delegation members. They'll be out in Roseville, New Brighton, and different areas for different projects. So many of us are going to be speaking at each of those locations. Lake McCarran's, our park at Lake McCarran's for the Rice Arpenter Alliance, and the Rice Street renovations will be there. But we're also doing they're going to be touring and hearing about River's Edge, and we'll be ending at St. Paul College, where we're doing presentations on the Bruce Vento Regional Trail and Riverview Corridor. We'll also be out at Gibbs Farm. I'll be there just supporting that effort. So most of I think all of our projects will be highlighted in some way, either virtual, either in person or in presentation for that bonding tour next Wednesday. So also, Madam Chair, a few of the other things that were going on. Victoria Street had their open house. There were a number of people that attended that. So I want to thank our Public Works for putting on that open house. Our Suburban Ramsey Family Collaborative had a resource fair that was well attended, and thanks to Ling Becker and different people from Ramsey County who had a part in that resource fair. And just want to talk about a couple of things that are coming up next week. As you'll see on your agenda, we're having a legislative committee of the whole after our board meeting on Tuesday. So we're looking forward to hearing the final report of our legislative agenda that we'll be passing in the next week. So we'll be working on that. And then just to encourage any of you that can come to the Ramsey County League of Local Governments meetings, this Friday, Sue Abderholden from NAMI will be presenting the NAMI legislative agenda. NAMI is the National Alliance for the Mentally Ill. And so we're focusing on mental health issues and mental illness at the Ramsey County League of Local Governments. And so many of our meetings are focused around that area and what we can all do. And this meeting especially, they're going to, with that agenda, that legislative agenda of NAMI, we're going to ask all of our cities and county to incorporate their, whatever we can of their agenda into our own, so that we can have the force of all of our entities at the legislature. So whatever we find useful out of that agenda, to make it part of our own. And we have many of these items already in our own agenda. But anyway, it's a really great meeting. Ramsey County League meetings are wonderful. We have a lot of support from our members, our member cities and school districts. We're getting 30 to 35 people there. I encourage all of us to attend these meetings. They're really informative and are getting a lot of support from our member cities. So thank you for that, Madam Chair. And that meeting is Friday morning. It's at 7:30 in the morning. It's on Zoom. They're really easy to go to. You just log on and listen to the great information that's being presented. So anyway, thank you, Madam Chair.
Thank you, Commissioner, particularly for highlighting that so that we can all have opportunity to check in if possible. And I will move on then to Commissioner Reinhardt.
Thank you, Madam Chair. And I also was part of the Landmark Center Gala virtually. And I loved the pictures that Commissioner Matas Castillo and her husband Hector my goodness, those outfits were really you. I have to tell you. And that also is a kind of a reminder to folks. And I know we've all been getting a lot of information, but the Give to the Max week or period of time here and is upon us, and there's a lot that's going on with that. And so encourage folks to look at their charitable giving. And obviously Landmark Center is one of those options. This week, a lot has been really focusing in on the environmental work that's being done, specifically climate change and action steps. And it seems like regardless of which meeting I was in for NACO or for the Clean Water Council or all of the different things that are going on, it really seemed to focus in on that. Commissioner McGuire, you mentioned PFAS and lead pipes and some of the funding coming into that. Those are huge in your home issues that people don't really think about because, you know, it's underground or you can't see it, especially is more difficult to comprehend that there is something that needs to be done. And lead pipes is a real important issue. The PFAS, that's one of the things. I was appointed vice chair of the Healthy Communities work group for the Local Government Advisory Council. That's the EPA advisory committee that I work on, or that I have been appointed to. And PFAS is at the top of the list as far as what we need to do. And that's something that is, you know, in your home and something that is incredibly important. In fact, JP and I just celebrated our 30th wedding anniversary, and what I asked for was PFAS-free pots and pans. And so that's what we got. Because honestly, I mean, it's something that people have to pay attention to. And when you think about the chemicals that were used in some of the old coatings, and you were cooking with this, I mean, it's pretty alarming. So, but what you can do and how you can do it is important, and what we can do to mitigate things that have already taken place. It's not just about replacing pots and pans, but it's about what we need to do to the environment and for water and for air in trying to deal with the harm that has been done. So that's really where I have been spending a great deal of my time and continue to. And I really wish I could be at the Ramsey County League of Local Governments meeting, but they happen to have, and Commissioner Fretham and I, maybe we could split up or do something, but that is also the same, it's at exactly the same time as the Neighborhood Concerned Citizens Group out of White Bear Lake, White Bear Township, Gem Lake area for water gremlin. And there's so much happening there as well. So it's at the same time, and we'll both get, or all of us will get information. I mean, that's, I think, the beauty of our board is that we share the information because we can't be in all places at all times. And so getting those updates is so important. So thank you. And that ends my report.
Thank you. Thank you very, very much. And we do appreciate there is a lot going on, and thank you for representing us as you listen to those concerns. I will go on then to Commissioner Fretham.
No additional update. Thank you.
Thank you very much, Commissioner Fretham. Commissioner Mattis Castillo.
Yes, thank you, Madam Chair. Since we met last week, we also had a successful election in our community's local elections. So I just want to say thank you to our elections team that handled that so well on Tuesday, and congratulations to all of our newly elected officials across all of our communities. Just wanted to share that. And then this week we have two really, really important holidays. And so just wanted to take a minute to recognize the first being the Marine Corps' 246th birthday, which is a celebration. So I hope you all will eat a little cake and celebrate my brothers and sisters that have served in the Marine Corps and my alma mater. And then followed up by on Thursday, November 11th is Veterans Day. And so just wanted to take a moment to say Thank you to all of our veterans and their families who have served and continue to support our country and recognize the service. And so I encourage you all to take a moment to thank a veteran for their service and to welcome especially our Vietnam veterans home. So thank you very much.
And thank you for the reminder and for all of your service as well, Commissioner Manis Castillo. Commissioner McDonough.
Ooh, who's had to go off?
I'm
Madam-
sorry.
Yeah.
I will go on. It appears as though Commissioner McDonough has stepped away for a moment. I will report that this past week, Commissioner Manis Castillo and I had the opportunity to join a tour along Riverfront to look at the projects which all connect to each other and which will create an active riverfront for us, in particular with River's Edge in the middle, our Ramsey County flagship project, and that River's Edge Park that will sit in the middle. We began at Science Museum. We walked down to the pier and we're able to discuss with members of the Science Museum team, the city, as well as the county, the connectivity of those projects and the opportunity that we will see. It was mentioned also that there is a tour coming into our port. I think it's Viking that is going to be bringing people from St. Louis and from Mississippi to our port here in St. Paul this coming year, and that as the unveiling of additional tours that will come in and out over the years. So it was very exciting. I also had the opportunity to be in a Greater MSP meeting this past week. It was a Greater MSP meeting at which we were able to discuss the Build Back Better proposal that our region submitted to the federal EDA, along with a proposal for Bold North Bio-Innovation Corridor. The Bold North Bio-Innovation, I guess it's really regional hub, is focused on creating careers and opportunities and engaging equity through a regional collaborative that Greater MSP is organizing. This is the first phase. Teams that go through that first phase and are awarded an opportunity will receive technical assistance and funds to build a second phase application. We're excited about the possibility that our region could end up being one of those teams that can build a second phase application, and about the connectivity of our counties, our businesses, our nonprofit and economic development organizations that will be working together, including our own Workforce Solutions and Economic Development Department, to describe a second phase application that includes all of us as owners and with the opportunity to build a bio-innovation cluster that is strong and beneficial for our region. So there is an upcoming webinar about that on Friday. It is on the website for Greater MSP, and it will be to cover the Bold North Bio-Innovation Update webinar presentation. With that, I am going to turn to
Madam Chair, I'm sorry. There was an amazing event that happened that I had highlighted, but I missed it on my second page of my notes. So if I could please talk about one other event that happened that we all can be really proud of, and it was at one of our Ramsey County parks, the one at Lake McCarran's, which is was a function of the Rice Larpenteur Alliance, which includes, the work of St. Paul, Maplewood, and Roseville, and Commissioner Manis Castillo, Commissioner Reinhardt, and myself, and Kim O'Brien, who heads that up. But we had a great unveiling of a mosaic in one of our parks that are there, and it was a mosaic mural that the whole community was a part of. And our artist is Shakun, who actually did one of the roses of Roseville in bloom, and then we helped paint the pillars of one of our park shelters, and now she's put a beautiful mural in one of our park structures. And Chris Lankowski from Parks and Rec has worked with her on that, and it was a total community effort. We had many members of the community there who had laid pieces of mosaic on there, you know, and who had helped paint the structure. So I know it'll be a model for other parks that we have and other parks that our cities have, of really engaging community in you know, arts in our parks. And I want to just give Chris of our Parks and Rec a great shout out for all of his dedication to that effort and working in that community. And there was money that was contributed from all different areas to make sure that that could happen. But if you get a chance, go to the Lake McCarran, to the Ramsey County Regional Park at Lake McCarran, and see the mosaic mural. It's really beautiful. So
Thank you for not
kudos to everyone.
neglecting. Thank you for not neglecting to share that with us, Commissioner. And certainly I'll be looking to see the mosaic there at McCarran's. I would move then to our activities for the morning. Following our board shop, we will have a county board workshop on redistricting for 2022. It will be available via a Zoom webinar. We'll take a 10-minute break between now and then. The Zoom webinar link is on our website as well as on the bottom of our agenda here. That will be for this morning. Commissioner McGuire will convene that for us 10 minutes after we recess or adjourn our board meeting. And then this afternoon at 1:30 p.m., certain we have a county board workshop on the American Rescue Plan Act funds. We alluded to that when we were talking with Zach Hilton and his award. It will be on American Rescue Plan Act funds for violence prevention initiatives. Again, available via Zoom webinar, and the link is posted on our website as well as on our agenda. I want to thank you for your attention, your reports, and for all of the work that we were able to do this morning on our board meeting. It is 10:41. We will reconvene at 10:51 for our workshop on the separate link. And thank you. We are now adjourned.
Thank you.